Okay. Creator, thank you for this beautiful day. Thank you for allowing us to be together and sharing with one another and learning with one another. Creator, I ask that you watch over all of our family members and our friends from all over the place, wherever they are. Please guide and protect them. Creator, I also like for you to guide and protect all those who are in foster care, who are incarcerated or group homes, who are living on the street, who are struggling in their lives and they need that extra little hug. And please, Creator, for all of our families who are still struggling, please wrap your loving arms around them and let them know that we love them and that we care about them and we think about them. Miigwech.
Thank you.
Can I just make one more, Nuria, if you don't mind? I just want to acknowledge the land.
Please.
I'd like to acknowledge that we are on traditional Indigenous land, no matter where we are gathering today. We are on Mother Earth, and she is a living being who we love, honor, and respect. The Mi'kmaq sit at the eastern door, which represents the rising sun. The eastern door is the land of new beginnings and where new knowledge can be created or received. So I speak to you from the eastern door with the Mi'kmaq people, and I just wanted to acknowledge our Mother Earth. Thank you.
Thank you so much, Monique. Good morning, everybody. Before I formally start, I just want to make to say a kindly reminders, friendly reminders. Please keep in mind that we are recording this session. Please feel free to use the chat function to share your thoughts and insights. That's really important for the flow of this conversation. There will be discussion opportunities after each short presentation, as well as at the end of the entire session. Please keep yourself on mute when not speaking, and just let's all be mindful of others who may also be trying to speak. Having said that, good morning, good afternoon, good evening, wherever you are. Hello, everyone, and welcome to our third Fireside Chat, highlighting the work of CAAN and VIV. And before we begin, I wanted to provide some background information on why we are hosting these chats. The Canadian Aboriginal AIDS Network is holding Canadian Institute for Health Research funds to host an in-person meeting of Indigenous women's HIV research stakeholders to develop a knowledge translation plan for Indigenous women's HIV research. Due to COVID, our plan to meet these past months had to be postponed indefinitely. But in the interim, we wanted to not only advance the work of the Canadian Institute for Health Research Catalyst Grant, but also find a way to stay connected with the stakeholders and the broader community. So as a team, we decided that we would host these monthly virtual fireside chats each month. This is the third one, as I said. So each month there will be a presentation on a different research project that will provide opportunities to share information and share in dialogue. If you would like the full calendar, please send an email to Karen Martin. She's our Indigenous Women Research Coordinator. I'm gonna text her email address on the chat, and she will be more than happy to share the poster for the series. And for now, I would ask our speakers to introduce themselves, please.
I can start. Hi, everybody. My name is Rita Ramadi, and I work with Impact Public Affairs. And in that position, I work with VIV Healthcare Canada, and through them, I work with CAAN. I've been lucky enough to work with the group at CAAN for almost a year now, working on some public affairs and some government relations. I'm really proud of the momentum that we've made, and excited to be doing projects like this and do some more great work leading up to Aboriginal AIDS Awareness Week.
I'll go next. My name is Mavela Sumchenje. I'm the manager, community engagement and communications at Viv Health pharmaceutical company, and I've worked with Viv from December, so I'm still new, but I'm not new to most of you. I've worked with you in different roles. Thank you.
Hi, I will go next. My name is Monique Fong Hao, and I am the Indigenous Women's Coordinator with CAAN. And I am Cree and Métis, originally from Saskatchewan, but I live in Nova Scotia with my husband and our children and our grandchildren. I am a grandmother and raising our 3 grandchildren. So I'll apologize in advance in case they come barging into the room. But that's the reality that we're living in right now with COVID and the scare that we had with the hurricane possibly coming through Halifax last night and today. And it looks like we got lucky and we didn't have too much damage or power outages. Thanks.
I'll go next. Hi everyone, nice to meet you all and see you all. My name is Sarah Martin-Spapastu, and I am Innu or Cree and Ukrainian. I live in Winnipeg, Manitoba, and I'm the Promising Practices Coordinator with CAAN, and started with CAAN in June. And I feel very thankful and lucky to be doing this work with this amazing community and team. So thanks for having me today.
Someone else I am missing to introduce? No? Renee, please.
Okay, I think she wants me to go first. Hi everyone, my name is Marnie Amiro. I am a community-based research manager with the AHA Center, a project of CAAN. I'm calling in from unceded Mi'kmaq territory in Dartmouth, Nova Scotia, where, as Monique has shared, we just braved what was a pretty wimpy hurricane, but we all survived. So yeah, my background, I'm French Acadian on my dad's side, English Irish on my mom's. I've been working with the Canadian Aboriginal AIDS Network since 2009, so I'm coming up on my 11-year anniversary in November, and it's just a pleasure to be here today. I'm really excited to see what kinds of discussions we can generate from our presenters and from the folks who have joined us as well. So thanks.
And so good afternoon. My name is Renee Mashing, and I also work with the Canadian Aboriginal AIDS Network. And like Monique and Marnie, I'm here at the Eastern Door in Mi'kmaq territory. And yeah, happily a wimpy hurricane for us. I'm not so sure down the shore further, but it's a good place to be. My bloodlines are originally from Southern Ontario. I grew up outside of Toronto, and my community linkages are Six Nations of the Grand River. But I've lived here in Mi'kmaq territory for about 25 years. So this is my adopted home. And I work with CAAN as the Director of Research. So this has been, this presentation today is a really lovely opportunity for us to share some of what we think we know, find out lots more that we can know, and to try and respond to the reality that COVID brought us to. So we're trying to control, I'll speak for myself, trying to control my PowerPoint fetish and need for presenting with lots of cues and really kind of imagine that we're sitting around the fire together, so that this is a chance not only for sharing information, but also for being together. Because one of the things that we were so looking forward to was having that chance to be together as women and as people who are committed to working with Indigenous women in Canada. And so really trying to strike a tone today where we get to talk about our work that we're excited about, but also gather and have a chance to reduce some of that isolation that comes from not being able to be in person. So I think, is there some more housekeeping that you'd like to cover, Nuria, and then we'll jump into presentations?
Yeah, actually, that was the perfect introduction. Thank you, Renee. Thank you very much for everybody for your introductions. And now, like we following our agenda, Monique, the floor is yours. So please, we're ready for you. And just a reminder, please, for our participants, attendees, feel free to write your comments on the chat while you're listening to our speakers. I'm going to keep an eye on your comments to bring them up. Please go ahead, Monique.
I feel like I'm been talking so much right now, which is great. I don't mind. I love sharing what I do and advocating. So, as I said, my name is Monique, and I am an advocate for women and families who are living with and infected by HIV, Hep C, and STBBIs. I use my voice to help those who are still living with stigma, living in fear of others who may not be accepting of who they are, and possibly who will judge them with their life choices or their diagnosis. So over many years, CAAN has developed 2 5-year strategies called, the first one was called Environments of Nurturing Safety, EONS 1. And in December 3rd, 2010, EONS 1 was released. Doris Pelche played a really huge role in developing that, doing consultations with our community members, and really engaging women from all over Canada. And she still is a huge part of EONS. I don't think she'll ever really totally leave CAAN and her role that she once shared here at CAAN. So EONS is about increasing and broadening the base of support for Indigenous women and girls. Just one second, I just gotta move this down. By creating safe spaces, building capacity, and increasing prevention strategies. On December 2nd, 2019, we launched EONS 2. So EONS 2 is about supporting Indigenous women and the organizations that serve them by offering tools to assist to increase the access for Indigenous women to their services. The main themes woven through this strategy are prevention and education and knowledge transfer, to include CAN's expanded mandate, which now includes HCV and other STBBIs, and to assist to address stigma and discrimination. So EONS 1 and 2 both suggest any strategies to address Indigenous women's needs must be built on a strong foundation that embraces issues of safety and the creation of safe spaces where Indigenous women are respected. The core values of EONS 1 and 2 are freedom to speak or to be silent, respect, accepting where women are at in their lives, courage to disclose, share, speak, or act without fear of repercussions, and generosity to care about our whole self in order to care for others. These values are what I strive for when working with women and in my own life. Over the years, we've heard from women with some of their concerns or issues, and some of these have been identified by Indigenous women from consultations across Canada. And also whenever I do any kind of presentation at our CAN skills building events, I usually will ask people and service providers that come and attend our session, what are they seeing with regards to Indigenous women's challenges and issues, and how can CAN help address those concerns? one of my coworkers, Sarah, will be talking a little bit about that and wise practices that you can use. But for now, some of the issues that were identified are how to deal with stigma and discrimination. We know that our women sometimes face multi-layers of discrimination and stigma. They're Indigenous, they're women, they're HIV positive or Hep C positive. So there's lots of labels that sometimes women have to overcome or feel challenged by. They would like to have culture and education brought together. And I can honestly say that over the past 6 months, we've gone through a lot of growth within CAAN. And one of the things that is coming are blossoming out of CAAN is culture. You know, we have a CEO who's very supportive and who's very spiritual and who is allowing that culture and that language and that being to come forth. And I really feel like we're in a better place to help women grow and heal. I really, that's one of the big parts of my job is I always want to help women see the beauty that they have within themselves. And sometimes, even when I think back to my own life, I think at how, you know, I have grown and how people are who, you know, some women who are sitting around this fire, this virtual fire, have helped me through the years see the value of my voice and see the value of sharing my life stories. So I really feel that CAAN is starting to address that. Language is another big challenge. And for many women, English is not their first language. So they want to be able to hear their language. They want to see their language. They want to see resources that reflect their language. And there's also the need for safe spaces where they can share their stories without judgment, where they can walk in and not feel like they have to act a certain way or be a certain way in order to engage in our services. And many women feel that CAAN has a responsibility to women because they're most affected by HIV, Hep C, and STBBIs. And also, one of the other big challenges is access to services. Many of the women that we spoke to have children and who may be living in households where they don't, not everybody knows that they're HIV positive, and they don't have that access to going somewhere and attending conferences, but so they need that easier access to our information and services at wherever they're living. I just wanted to ask a question so that you feel like you can help be engaged in our process. Do you feel that there's anything missing? Do you feel that there's concerns in your community with regards to Indigenous women? And what are those things that we're missing? Does anybody want to share?
Or also feel free to put your comments in the chat, and we all can have access to that at any moment. I am keeping an eye on that, so please feel free as this conversation is flowing to drop your comments there.
Maybe what we can do is get Noria to just keep an eye out for those comments.
Yeah.
And if she if you do have a comment or something you want to share, Nora will let us know. But I will hand it off to Sarah, who's one of our coworkers, and she's going to talk a little bit about the resources that CAAN has. Thank you.
Thank you, Monique. Sarah, floor is yours.
Great. Hi, everyone. Thanks, Monique. So I am going to share a little PowerPoint slide. Forgive me. The first time I've used the platform, so I hope it goes okay. Let's see. There we go. Everyone see that? Yeah, okay, I see some heads nodding, good. Yeah, so I just wanted to share a little bit about the information sheets that in programs with the Promising Practices program that we are working on. So there was 4 information sheets based on wise practices in this work created by CAAN staff last year. And the information sheets were, there's 4 of them. One of them is called Indigenous Leadership in HIV and AIDS, and really highlighted the JIPA and MIPA principles. The second one is called Creating Safer Spaces for Indigenous Women Living with HIV and AIDS. The third one is called Youth Beyond Risk. And the fourth one was about documenting lessons learned. Yeah, so the one we're going to highlight today is the Creating Safer Spaces for Indigenous Women Living with HIV and AIDS information sheet. These information sheets were, like I said before, made by CAAN staff and were based on research and projects that CAAN has done. Yeah, and really created to facilitate knowledge transfer to organizations and communities and highlight wise practices in the work. So with the info sheets, we are doing a pilot project right now. I'm facilitating a pilot project right now with the information sheets. And I facilitated a workshop highlighting the wise practices in the info sheets with 3 organizations from across Canada in August. And then in September this month, I'm sending out a questionnaire to those organizations to see if they were helpful, if they've integrated any of the wise practices that were highlighted. In the workshop, we did an activity where the organizations assessed, like, how do we already represent these wise practices in our work, because of course they do in lots of ways, and then also assess, like, what are opportunities to integrate them further. And so in September, the questionnaire is going out to see how that's going. End of October, we're having meetings with each organization to talk about final findings and if these resources were helpful and the workshop was helpful and how that integration process went. And so yeah, in November, we'll compile that final findings report, and then in December, I'll be doing a presentation on this pilot project at the AAAW events. So watch out for that. But I just wanted to highlight for this session the Creating Safer Spaces for Indigenous Women Living with HIV info sheet. So this is what it looks like. I'm not going to go over the whole thing, but kind of as I said before, this info sheet specifically was created by the Indigenous Women's Coordinator with CAAN, Monique, and the AHA Center Community-Based Research Manager, Marnie. And wise practices were compiled from various CAAN research and projects, including the EONS project that Monique was just talking about, our Search for Safer Spaces, and the Visioning Health 1 and 2 project, among others. And some wise prevention practices that were pulled out of those projects and research that CAAN has done was number 1, prevention education is knowledge. Number 2, culture saves lives. And number 3, we need to be making our organizations or communities safer spaces. So I'll just talk about that a little bit more. So prevention education is knowledge. We need to look at HIV as a teacher. It helps us to talk about difficult topics like sexuality, sexual orientation, disclosure, and more importantly, helps to address misconceptions and myths. By having open and non-judgmental conversations about HIV and other STBBIs with community, friends, and family, we give them the tools to make informed, healthy decisions. The second one was culture saves lives. Yeah, one wise practice that was identified was that Indigenous tradition and culture are healing, and also a way to celebrate Indigenous roots and identity. Learning about Indigenous culture and partnering with local Indigenous organizations, care providers, or knowledge keepers to provide culturally relevant care can help mainstream organizations create a safer space for their Indigenous service users or clients and Indigenous women. And then the third point was we need to be making our organizations or communities a safer space. Indigenous HIV service organizations should work to ensure they provide a safer space for Indigenous women living with HIV and AIDS. Organizations can consider assessing how well they are meeting gender-specific needs, identifying the gender-based barriers preventing access to services, and devoting the necessary human and financial resources to filling gender gaps in service provisions. Those are the three wise practices identified, and then activities that were pulled from those, wise practice activities that were pulled from those further to create a safer space were to provide non-judgmental, gender-inclusive, and culturally relevant education about HIV, HCV, and STBBIs. Invite Indigenous women living with HIV or women living with HCV or other STBBIs to share their stories and answer questions. Create safer spaces policy statements and post it in public places to show commitment to creating a safer space. And also not just post a policy statement, but also create procedures and consult with community to really create that safer space. Increase partnerships with regional IWHA organizations and invite them to facilitate capacity building events. Review policies and procedures to ensure excellence in confidentiality practices, and host information sessions with women to identify what training they want and listen to them. So one huge wise practice is that if you are creating practices, if you're creating information sessions or documents or anything, it has to be informed by the community that it's intended to serve. So that was a big one that came up too. Yeah, so I will stop talking. So I think that this project, well, actually, sorry, I'm going to talk a little bit more and then I'll stop talking. I think that this info sheet sort of like process and project with the three organizations is an example of bridging research and programs within CAAN and facilitating knowledge transfer and engaging with community as well to see if these resources are helpful, and then get feedback, and then make our resources better in the future, or create resources and tools that are helpful. So one, I guess, a discussion question that I'll open up to discussion are, what are wise practices working? What are wise practices that are working with women or organizations in your communities? Or what resources or tools are helpful? If anybody has any ideas or wants to share.
Excellent, Sarah. If someone else have a question now. Can you look at the chat, Sarah? There is, Harvey says, in the agencies and organizations that many women access do not specifically have programs or services geared towards their health. Many women feel powerless because agencies are not focusing on their needs. Isolation is a major factor in not disclosing their status to service providers. There is a common bond between urban and isolated communities. Many women belong as individual members, which gives them the right to propose changes within these organizations and agencies. Decision makers need to be informed about the realities of living with HIV, HCV, etc.
Yeah,
Thank you.
I just wanted to say thank you for sharing. And actually, when I facilitated the InfoSheets workshop with the organizations in August, one big piece of feedback that came out of that was that they suggested that we do workshops like this to share wise practices with decision makers and policymakers and funders, so that they're aware of wise practices in our work and culturally relevant practices. Thanks for sharing that.
Thank you, Sarah. Thank you, Monique. And now, like the research team, ta-da! The floor is yours, please.
All right. So really welcome any comments or interruptions as well, because we would like to have that energy of sitting around together around the fire. This opportunity for a fireside chat is in part the reflection of some of the work that CAAN has been doing, and you heard this in our introductions, in some work in partnership with VIV Healthcare and with Impact. So I just wanted to say a little bit about that and then talk about some of our research journey, but leaving lots of space for other conversation as well. So CAAN and VIV came together to talk about an opportunity to partner. And when that conversation came up, many of you won't be surprised. One of the first things I said is, we've done incredible research. I'm really proud of the work that we've done and the ways that we've done it. But I feel like we haven't done such an incredible job of getting it into people's hands. And we would love to learn from a company and from a partnership about how to do knowledge translation effectively. We have lots of ideas about the theory and process, but using social media or using different communications tools, having access to a marketing department would be really exciting to learn more. And so our friends with VIV and with Impact have been part of this process with us to really refine how can we have some clarity of this partnership. And we talked about having some core objectives that that part of this fireside chat is doing, is also helping us to learn how to advance this work. And we really want to continue to promote CAAN as a trusted resource for government officials, for key decision makers, for our community members, in part through this amazing resource of a community and a network that CAAN is connected to and represents, that we want to have these groups of people, these decision makers and people who are trying to influence view CAAN as a critical stakeholder in decisions regarding HIV and health-related matters. And I think that's both being recognized and having the capacity to be able to respond to that quickly and effectively. And of course, in all of the work that we're doing in all of our places across the country, that we know that the messaging of nothing about us without us is so central to how we're working. And so as Indigenous people, as partners, as allies, that we are leaders and have the solutions for our communities that are informed by our communities. And so really to say, let's work together to entrench, come to CAAN for information and wisdom as much as we can offer that with humility and respect to the voices that have informed what we think we know and understand. So that partnership work has kind of led to this really interesting and deep conversation about how we know what we know, how we work within CAAN, how we work externally, and how we reach out. And of course, in the context of what I get to contribute to that conversation and what our research team more broadly gets to contribute, and Marnie and I are here to present and talk about today, is some of that research journey, and particularly thinking about how that journey has engaged with Indigenous women. So, for some of us have been around this table for some time, forgive me when I share what's well known and what may be new for others. We began really formally engaging in research work in the late 90s. and even more so into the 2000s. And this kind of coincides, interestingly, with the establishment of the Canadian Institutes of Health Research. So while CAAN's research life has been growing and evolving, so has this big research funding body in Canada. And I think one of the things that's really exciting is that as CIHR was being established, there was a transition from one funding body to another. And we had just been successful with the renewal of the National AIDS Strategy to see dedicated dollars for HIV research with Aboriginal people. Of course, we were using the terminology of Aboriginal at that time. And there was a lot of concern about what's going to happen to this money. We've worked so hard. We've worked so hard in our partnerships and relationship building with the Government of Canada, particularly with Health Canada. And now there's this new entity being established that's going to have some opportunity to administer dollars. And particularly, of course, of concern to CAAN and to our stakeholders within our community was Aboriginal dedicated HIV research dollars going to this new entity that we have no relationship with. And so one of our very, very first successes in research was advocating that that research money stay with Health Canada for a number of years. And it turned out to be, we agreed on a 4-year moratorium. So the money stayed at Health Canada, and that created an opportunity for CIHR to establish itself and learn about managing community-based research and HIV research. And it also created a space for CAAN to, and other stakeholders, but CAAN has always been a leader in research in Canada. We're a national body, we're not at the front lines. We had a staff that was dedicated to and interested in research, and a network that really connected us to our membership. And so CAAN had an opportunity to learn about the research process as it transitioned, as the research money transitioned from Health Canada over to CIHR. And I think that really created an ownership for us as well, because we were so successful in our advocacy to say, this is how this needs to happen. This is what makes sense to the community about how research is going to begin and evolve around Aboriginal peoples and HIV and AIDS related issues. So as we begin this research journey, we began by reaching out to our membership, and we consistently, this is part of our raison d'etre, it's part of how CAAN is established, that we're really led by what our membership and our community members are telling us. And around this time, we were also hearing people, like Monique, you said, like yourself, like Doris, who were speaking up with louder and clearer voices saying HIV is affecting Indigenous women in a profound way, and we need to be paying more attention. We need to be hearing the voices of our women. And so our research trajectory and our community trajectory in terms of engaging with Indigenous women was kind of on a similar path of listening and paying attention and being called in to a response. And so we learned early on that we wanted to establish and be clear about our research values. And Harvey, you were one of our very first community-based research steering committee members who was part of this process of creating CAAN's research unit. And so we knew that we really valued and had a home in community-based research frameworks, in a way of doing research that was directed by community. That our projects in that CBR format would be informed by our travel, our AGM, the time that we spend with real people, living real lives, having real needs that have to be understood better. And that we wanted our project leadership to come from CAAN. And so that meant CAAN staff, it meant the way that we would work with our academic colleagues. It always foregrounded working with our community. It meant that we had opportunities to engage with policymakers. We'd often sit at tables with the Public Health Agency the tables that literally established Public Health Agency, as well as sitting with Health Canada and other decision makers who were designing HIV responses in our communities. And so we wanted to be sure that it was really clear in our research that was where we were coming from. And some of the things that we learned in those early years that we've kind of been pulling the thread through in our work is that we started off, research kind of calls you in as a research process to define the research problem. And that's those of us who have been to school have been trained to learn about the problem and investigate problems. We were coming up in a time when the need to respond to HIV was so intense and immediate, and there were so many issues. There was so much happening that we were angry about and mad about, and so we were really oriented towards looking for the deficits and calling out. You can't treat our people like this. These are problems that have to be resolved. And so with that mindset, we had done a number of research projects, and And then we came, and this is, I was kind of moving into a different role with CAAN at the same time that we were working on a project that was called Alcohol Use by Aboriginal Persons Living with HIV/AIDS and its Association with Access to Care and Treatment. We're really good at nice short names. But so, and this was really a project thinking about like how is the perception, right? Just the assumption that Aboriginal people and alcohol have this close relationship, and how does that affect access to care and treatment? And so we were asking questions. We did a survey and we did interviews, and in that space between learning from the survey and then kind of trying to dig deeper into what we were learning in our interviews, we were all ready to be really angry and to pursue all of the terrible injustices that were happening. And so we asked, what is your relationship like? How are you accessing care? And what we heard was actually things are pretty good. I have a good relationship with my service provider. I feel good about my doctor. I have some issues here. Social services, there was still a lot to be angry about. But in many other areas of access and care, we were actually hearing positive feedback. And so that kind of set us back a little bit and led us to rethink about, well, how are we doing our research and why are we looking for, we're so oriented looking for problems. But in fact, what we were hearing was that there's a lot to be celebrated and encouraged, and that instead of doing presentations and looking at research and doing work that would call out the wrongs, we could really highlight and lift up the rights. Right? This is the good work. This is the good work that needs to be done. And this is the positive change and the outcomes that we want to promote. And so, of course, that helped us to also think about transitioning to a science-based approach to our research overall. To what that meant, certainly visioning health is our kind of shared community example of a really strong project that stopped asking about what makes you sick? What's it like to be sick with HIV? And turn the question around to think about what does it mean to be well? How do you stay healthy living with HIV, right? How do you envision your health? And more broadly in CAAN's research work and our approach and our lessons learned, how do we think about doing research so that we can start promoting the solutions and be really grounded, not ignoring where there are problems, not denying that there are things that we absolutely are still angry about and need to be called out and need to address, but that the way to address that is not to say this is a problem, it's to say this is a problem and this is the solution. And our research is part of finding those solutions. And that really created an exciting place to be and to work and an opportunity to give back to our communities. And even more so, I think, in that opportunity to give back has been the realization for ourselves as staff, and forgive me for speaking on behalf of all my colleagues as I say that, but also in our research process, that research itself, that having a space to think about what's happening in your life, to think about what's happening in your community, that when we're doing research well, it has the power to change lives. It has the power to change how you see the world, how you experience the world, how you see and experience yourself in your own life. And that has been both a responsibility and an opportunity and an incredible gift that research has brought to how we're doing our work, and a responsibility to be really mindful that that research can change lives for the better, and we know it has. We've heard that from the people who we've done research projects with, and I think we've had that experience ourselves. I have. We also know that research not done well can have profoundly negative impacts, and we've heard that. That's one of the problems that we've pointed to in terms of the research enterprise overall, and it's one of the problems that CAAN has had to own and address and learn from. And so, learning how to care for and put support in place in our research process, and when we really attend to that, it can be magic. And I think the other another really solid core learning that has kind of been part of CAAN's work all along, and Marnie, thank you. This is work that you've helped to pull together. I'm saying I, but really we and our team. But knowing that theme that we talked about with ViiV in this partnership as well, that nothing about us without us as Indigenous peoples, and specifically JIPA, nothing about us without the voice of people with living experience. that is so central to the way that we do our work. When we think about what our research questions might be, how we're going to approach somebody and ask about experiences, that we're really mindful and thoughtful about how we can be as respectful as possible, both in terms of how a question is phrased, as well as how we carry that information and what we learn forward. And so when we think about our work with Indigenous women, I think that there are points where we see great success. There are points when we have to really appreciate the opportunity to learn. And so, you know, one of our first projects was Two-Spirit Women's experience of homophobia. And that was responding to a homophobia project that CAAN did related to men's experiences. And it turns out that Indigenous women and homophobia is a very difficult conversation to have. It was difficult for our women. It was difficult for CAAN. And I think it probably stands out as one of the only research projects that we've had to say, we don't have this right. And we're going to have to give the money back, and we're going to have to pay attention and learn the hard way here, and really pay attention to what happens next and what comes forward. And that was a lesson in humility that still stays with us, and I think still calls us to pay attention. We've also, in that strengths-based approach and understanding of the world, and to the work that Sarah has presented, that came from a project that was submitted and called Sexual Violence, HIV/AIDS, and Aboriginal Women. And all through the project, it was called the Sexual Violence Project. And when it came to the time to write up the final report, and we looked at what we had learned and the stories that we had heard, and the experiences that were captured in that research, and the profound lives that our women had lived, we realized we couldn't put out a report that was called Sexual Violence in Aboriginal Women. And so that report changed to our search for safe spaces. And that began that shift in terms of our explanation and our understanding of our research to talk about what we're learning from this research and where we want to be going. Where do we need to be? What are the solutions we're looking for? And that led to learning more about policy work. And of course, in a broader scale of HIV and Indigenous women's research, CAAN has had opportunities to partner with amazing projects. The Visioning Health Project, of course, the CHIWOS Project, which is part of what is creating a home for Indigenous women's research program within CAAN, or work that builds on CHIWOS. We've been involved in partnerships responding to our investigating sex work, and how complicated it is to talk about sex work in Indigenous communities in a way that is respectful to our leadership, that is respectful to our women engaged in sex work, that is respectful to the diverse understandings and values and concerns related to sex work, to the point where that project and reporting about that project became highly politicized and really called us all into thinking about what it means to have a responsibility to our research participants, as well as to our team members who had different expectations of how the research might play out, and what it means to have a responsibility to share research or not to share the research because of what the implications may be. We've investigated or been part of investigating mothering and living with HIV, criminalization, stress, and starting to do some work around understanding cannabis use and HIV and Indigenous women's lives. And in addition to this, all of this amazing work, one of the vehicles that we created to share it, of course, is our journal. And so we have 10 volumes of what began as, again, great titles, the Canadian Journal of Aboriginal Community-Based HIV/AIDS Research, and is now titled the Journal of Indigenous HIV Research, Volume 11, coming out in December 2020. Volume 11. I don't know if we ever would have imagined, I think we hoped that would be the legacy of this project. And so, Marnie, I really welcome you to add in, but this is kind of that snapshot of a journey, particularly thinking about our Indigenous women's work. And I think many of the faces and names I see on the screen have been part of that journey with us.
Absolutely. Well, I just see Monique here has asked a question: how do women get involved with research? So I think that's a really an important question to answer. And I think that there's a lot of a lot of avenues that women have been brought into the research project, from starting as a research participant and being, I don't know, I guess you could say bitten by the research bug, and then learning more about the process just through engagement, and then becoming parts of research teams. We have at CAAN, we have the AHA Center, which is a research center designed to support people, well, in research on HIV done in Indigenous communities across the country. So we, at the AHA Center, through the AHA Center, we offer different workshops teaching research methodologies, and even starting with, you know, I'm invited to a research team. So what does that mean? Like helping people who haven't been engaged in a research project or process before understand, at least, you know, every research project has a life of its own, but understand sort of some of the nuts and bolts of what it means to be part of a research team, and why their contributions are so important, and those kinds of things. Yeah, we have mentored people, like set on research teams where there's new folks involved, and offered support where we can to help them, like to help people who are new to the process develop skills and so on as well. So there's workshops and mentoring roles that we have. Yeah, there's lots of ways to become involved. And if someone is interested in becoming part of a research team, I mean, contact CAAN, and we can, like, we generally, at least with our organization, have a pulse of what's going on across the country. So can put you in touch with different academic colleagues of ours and research teams that are active right now across the country, and so on. Yeah. There's lots and lots and lots of ways.
Well, and Val has highlighted that in the chat as well, the incredible importance, to your point, with you and Marty, Val and Marty are on the same wavelength around peer mentorship, and just how important that is, and the fantastic training that Val's been part of as well, in terms of Indigenous research associates. Yeah. And Harvey, you're right. You're a strong and consistent voice around moving into, you know, a lot of CAAN's research is social science based, and so our partnerships have been moving more in, or slowly kind of gauging into science. And of course, our partnership with the Feast Center is probably the most explicit way that we're envisioning challenging ourselves to think about epidemiology, about clinical research, about basic science research, and of course the social sciences as well, but really to make sure that there's attention to Indigenous issues and HIV and Hep C and related STBBI or STIs, I suppose, if we talk about HIV and Hep C separately, and that needs to be given more attention. So that's work that CAAN and Feast are partnering on, or CAAN and McMaster are partnering on through the Feast Center. So it is a challenge to bring in all of those expertise, and also a nod to Sugandhi, whose name I saw. Yeah, so under policy advisor is bracket Sugandhi, who's also got an epidemiology background. So we're stepping into new areas, but probably not as quickly. You've been a clear voice about that need for a long time. You're heard. It's the challenge of getting there. Thanks.
Thank you, research team. So now it's and thank you for your comments on the chat. Are really meaningful and are just adding value to these incredible conversations. So now, Marvelous, please, the floor is yours.
Thank you so much. So much I'm learning from the previous presenters. It seems like every time when we sit together or when we touch base, I'm learning new things that you're doing, and it's great. And I feel honored also to be invited to come to this fire and sit by the fire and learn from all of you. But also, this is the symbol of fire. to me means a lot, because fire brings warmth, and fire is also is a place where women normally sit when they're cooking, and we get nutritious food that makes us feel full, and also that makes our brains work. But fire also sometimes is scary, because sometimes you're always sitting cautious of whether you're going to burn your feet or anything else that might happen to injure one of you. But I'm glad that you've created a safe space where we are not fearful of injuring each other's feelings, but we are here to share the warmth and to learn from each other. So I was asked to present on women, HIV and stigma, and I just wanted to share a few examples of the work that VIV is doing, but also what we are hearing in Canada and globally about stigma related to women. Next.
I'm trying. There we go.
So I thought before I go in depth with the examples, I wanted to give just a snapshot of who VIV is, and apologies for the text. I think once the slides were shared and they were downloaded, they did their own thing and changed the text. But that happens. In research, you always, sometimes you expect some things that you didn't plan for ahead of time. So this mission is to leave no person living with HIV behind. And that also includes women. And our values and expectations are at the heart of everything we do. They're integral to how we conduct our business and form an important part of our culture. And our values include that we are patient-focused, we love transparency, we love respect and integrity. And our expectations are just showing the courage and both ways as VIV staff, and also the courage to communicate with stakeholders like CAAN, and being accountable, and development, and also teamwork, of which this part of the work that we are doing with CAAN is also one of the examples of the teamwork that VIV does. So when I joined VIV, I did just come because I wanted to change my position. I used to work for Women's Health in Women's Hands, which is a community health center in Toronto, serving African, Caribbean, and Black women, South Asian, and Latin American. But I was doing HIV work. And I also was working with VIV in the global research. And I used to challenge every time. The person that I was mostly in contact with was Lon before Matthew jumped in. And I used to challenge them and ask them, how are people living with HIV involved? Is there greater and meaningful involvement? And of course, the door was open to challenge. So I joined VIV because of these values. As a person living with HIV myself since 1995, I've seen so much globally. I've seen so much when I moved to Canada, and I wanted to be in a place where I can be authentic, a place where I can bring the voice of people living with HIV, not only Black women, not only Indigenous women, but all women, diverse women. And how do I do that? I always make sure that I communicate. Maybe sometimes I just send an email to Renee, whether on Facebook, or to Valerie, or to anyone in the community that I know, to just get feedback. So that's who I am, is Marvelous, and my social location as a woman living with HIV. Next. So the VIV and CAAN partnership is a joint partnership. The aim is to support CAAN in developing an action communication plan to engage policymakers to promote an Indigenous-led HIV response in Canada, with particular emphasis on access to treatment and care in culturally competent ways. I like the word joint, because it's not just a joint of saying, okay, we could joint. I think the meetings that I've set already with CAAN and VIV and Impact, the relationship is cool. Like we are open to do friendly amendments, to share how we feel, we build each other. So it's not a one-way traffic. There is no power dynamics. We make sure that we are at the same level. So as such, we decided to come up with 3 key messages that need to be spread out. Of course, most of the feedback came from CAAN, it's not from VIV, but VIV was also open to say, what about this? Maybe you should also consider this. But CAAN was taking the lead. So peer-led responses lead. So the messages are peer-led responses lead to stronger health outcomes, and HIV stigma generates more HIV. We need a response to the HIV crisis growing in Canada, especially in Indigenous communities. So these are the messages, and this is one of them. I think the activity that also addresses touches a little bit on stigma, but there's more work that's being done on that partnership. And we like the way it's going so far and look forward to the growth. Next. So unfortunately, some of the faces that you will see, you know them already. These are great players in the HIV movement, and I respect them. I learn from them, and we learn from each other. So when we look at HIV, it's disappropriate. It actually affects women and girls differently from how it affects men. And when we look at the statistics globally, we see that HIV is increasing among women, and that is the same also in Canada. We're seeing a lot of, and people might ask, why is it that there's still people getting infected with HIV in this day and age? There's so many reasons. It's because sometimes because of the culture, because of the social and economic status, sometimes we end up just being exposed to situations that put us at risk as women. But also we've seen a high number of young women also getting infected, twice as much as young men if we compare, and that's concerning. Next. So when you look at stigma, we always hear about stigma, we hear about discrimination, but what does that mean, and how does it contribute to the increase in HIV? We've also heard the word of intersectionality thrown around, especially with academia, but also in the workplace. But what does that mean? So when we look at intersectionality, we are looking at, as women, we have so many roles. I'm a wife, I'm a mother, I'm a service provider, I'm a woman living with HIV, but I'm also a woman living with diabetes, I'm a sex worker, or there's so many things that make me marvelous. But sometimes when people look at how I play out, whether within AIDS organizations, they just say, oh, she's troublesome. But they don't look at what causes that troublesome. I've had situations where clients have been banned from organizations, but we don't entwine all those things that make that individual. And that also plays up in stigma. You face stigma as an individual. Sometimes you stigmatize yourself, and sometimes when you look, community also stigmatizes you. And sometimes when we move out, accessing services within hospitals, you are also stigmatized. So there's so many things that play out when you talk about stigma and discrimination. Next. And also, when we look at those all those things that make up and that contribute to who I am and how I face stigma, they contribute to who I choose to share my HIV status with. And in so many cases, it's valid because people have been treated bad in hospitals. People have been treated bad in AIDS organizations. But even with the advancement of treatment, we've seen that there's treatment, people are living well. And me, if I don't tell you that I'm HIV positive, you won't know that I'm HIV positive. Unlike before, when there was no treatment, you could tell that this person is living with HIV. But that being said, still, people feel to disclose their HIV status. in a study that was done by VIV Healthcare called Positive Perspectives. So there's phase 1 and phase 2. Phase 2 is the one that we currently did, of which we can talk about it later on how I can share that study findings. But in wave 1, participants were asked how their lives had changed both positively and negatively over the last 5 years of living with HIV. And the 2 top negative responses that they reported back were that HIV still carries a lot of stigma. Even when we're talking about now that we know it doesn't only affect people who are promiscuous, it doesn't only affect gay men, or it doesn't affect only maybe people who put themselves at risk, there's still stigma. And also people say that I'm unable to engage in a relationship. So we've seen in another study that CHIOS, we've heard about CHIOS before, we found out that also a lot of women are not in relationships. So they've chosen to not even engage in having sexual intercourse because they don't want to disclose their HIV status, because the responsibility is put on them to protect themselves. And then when you talk also about criminalization of HIV non-disclosure, that adds also another burden to why people do not disclose their HIV status. Next. And then when we look at HIV-related stigma, marginalization within healthcare settings appears to be intensified for sexual minorities and transgender women, also sex workers and racialized women of color living with HIV. So I think also it gets intensified when you think about immigrants. And I've heard this thing being said one time when I went into another hospital, which I'm not going to say, and I disclosed that I was HIV positive. I thought that was going to improve how I was going to receive care. The person behind the desk asked, "Oh, you're from Africa. You are the people who bring HIV to Canada ahead." So already that, if I wasn't an activist that I am, I would have walked out. I would have proceeded with the corridor to see the next person, considering that in these healthcare settings, every time when you go and see a different provider, if you say you're HIV positive, they want to know how did you get it. They want to know other things that you have to go in and start to reveal. I think sometimes some of them, I've heard some of them say, "Oh, so were you promiscuous? Oh, didn't you know that there's condoms?" So for many people, and I've seen also Indigenous friends of mine saying the same things, saying, "You know what, sometimes I don't even go to certain places because I don't want to be judged. Before I even say anything, I'm already judged." Which leads to the internalized stigma that we feel. It reduces our self-esteem and our self-worthy. You start feeling dirty. You feel like, oh my God, what are people seeing? You start even thinking that it's written on your forehead wherever you walk anyway. So that internalized stigma also prevents people accessing care and treatment. And it also increases a vulnerability to HIV infection by reducing access to HIV prevention. Even today, when there's a lot of centers that are giving anonymous HIV testing, people don't want to walk in. They don't want to go and do anonymous HIV testing because automatically when you're walking there, you're almost saying, "Yeah, I am. I'm risky. Yeah, I am. I'm promiscuous. Can you test me?" So that also doesn't do well to the public health messages that are going out because people feel being judged. Next. So this, when we transfer, then it's blurred how it's showing. But when we talk about stigma and disclosure, in also positive perspective, we realize that the self-stigma that I was talking about also makes you feel guilty. It makes you feel like, am I should I have babies even if I'm taking treatment? What about if I infect the baby? So it brings so many things and questioning yourself. But there's also institutionalized stigma, which I talked about. It's not only in hospitals, it's also accessing jobs. So if I'm taking treatment, if I need time to get away from my workplace to go and access maybe blood work or my doctor, do I need to disclose my HIV status? Would people assume or know that I'm HIV positive? And then the physical stigma. It's the physical stigma also just, I know sometimes when you take treatment, you might change how your body looks, or it might, like for myself, I was thin. If you saw me when I came to just my other, before, I was so slim, I was almost like a model. And there came a time where I just felt like everyone looking at me thinks I'm pregnant, 9 months pregnant. And that's so stigma also just makes you feel like when you walk, people will tell that you are HIV positive. And also abandonment. Some people also might abandon you, especially knowing that when you come into Canada, especially for refugees, you stay with friends, you stay with community members. You don't want them to know what's happening. So sometimes what they know, sometimes they'll isolate you. And then there's the social stigma, feelings of isolation from the local community, like I've said. Some people start just guilty by association. So if I'm seen with Marvelous is public about her HIV status, will people also know that I'm HIV positive? Then there's this just verbal stigma where in the communities, I think it's also familiar in the indigenous communities, just rumors going around and labeling, people calling you names. That also increases people not disclosing their HIV status. In the study, one person said, I feel dirty and stigmatized. I have a lot of fear and loneliness. And there's this lot, even if you know you're looking good, as sexy as Rita says, I'm still looking like a model, but sometimes you can't help it. You just feel like, well, who else knows about my HIV status? And what impact does it have to my family? It's not, because it doesn't just affect you, it affects also your children, your husband, whether it's negative or positive, the whole community. It's not only you yourself who's HIV positive, it's also the people that are around you who are also classified as HIV positive. Next. So yes, I've said all that about stigma and how we get stigmatized, but even if we get stigmatized, we fight. We fight back, and there's different ways that people have fought back. They've participated in research projects so that they know that they can include stigma questions in the questionnaire, or sometimes they feel like maybe even the researchers stigmatize people living with HIV, who they want to be participants in research. So we show our resilience in different ways. Sometimes we become peer facilitators, we become peer navigators, and there's different ways of knowing and spirituality that also facilitate how we cope. And sometimes that way is not respected in research. And sometimes that way is not actually recognized as the right way to do research. So which brings us back to the what when we're talking about decolonization and trying to see how we keep on fighting and make sure that the methods that we use are authentic to ourselves and should be authentic to the people who want to publish our work. If they don't want to publish our work, they can't force us to change and go in a certain direction. So that calls for activism, that calls for being clear as CAAN and what ways in which you want to present yourself as CAAN and standing your ground. Because some of these methods have got ways of when I'm a social worker, we talk about theories, we talk about episteme, all these heavy words that we hear. Sometimes when we want to do that research as people living with HIV, we can't do it because we don't have PhDs. But then, or we don't have even any academic affiliation. So how do we bring our thoughts on the table? for people to hear what we want as people living with HIV. So this is something that I think we should keep on pushing as CAAN, and as VIV also supporting you in ways that we see fit. We don't direct you to how we want you to go, but it's up to you as an agency. Next. So with that said, I just wanted to find out from you if there's anything that I've said that resonates with you. Is there something that you want to share in terms of stigma in research or participation in the community or accessing services? If you are not HIV positive, but you can also share how the people that you interact with, how it impacts them. Yeah, Renee?
Well, I just want to say, wow, that was amazing. But I see Melanie's got a comment, so maybe I'll.
Okay. Go ahead. Oh, Melanie, great presentation, and a lot of self-stigma because I got lipodystrophy from meds, and to this day, it hasn't improved. Yes, for sure. And that also brings back, when we look at research itself, a lot of research has been written showing how women do not participate in clinical research. And also, so maybe also some of the side effects that we are getting, if only there were a lot of women who participate in research, maybe there might be treatment that is developed just for women in future, or maybe there will be innovative ways of addressing how we deal with the changes in our body, the body image, and so that we can keep on taking our treatment and not stopping taking our treatment because we feel shameful. Thanks for that comment, Melanie. So if there's no other contribution, that's okay. We can go to the next slide because we have another opportunity to discuss. Next. So I think out of my rambling and trying to bring my points forward, I think some of the key takeaways that I would like us to live with is that when we are not the only ones in Canada who face that. Worldwide, women represent 52% of people living with HIV, yet represent only 19% of people taking part in HIV ARV trials. That was what we found out from the positive 2 perspective. So as we hear about any clinical trials happening, we need to find ways of how we can encourage women to participate. Of course, we have to find out also if it's beneficial for us, and ways in which how we can meaningfully participate. We need to come together to recognize and solve these issues to give women the best chances in life. Because it's not everyone who has maybe access to computers or have to see calls of study participation or services that they can have as people living with HIV. So we need to come together and address those gaps. And we need to continue we need challenges stigmatizing community, social norms, and structural inequities so that we can facilitate health promotion and social justice. Thank you so much for listening.
Wow. Thank you, Marvelous. Thank you. There are like lots of comments in the chat, of course, like appreciating this incredible conversation. Marvelous. Thank you for being this generous to open the conversation on this deep level and being humble and generous to share your story. Because at the end, it's so personal and it's your journey, right? And so of course, like the chat is open. If someone else has like more comments, I'm gonna keep going with Rita, who's gonna share with me this tiny section while everybody is probably trying to put their ideas in order. And if you want to jump on the conversation on the chat, please feel free to do it while we are talking here. So I guess it doesn't matter how many times you listen to these kind of conversations, you all the time get something new and get some, I would say, fresh air to say, okay, keep going, right? Keep going. And I really appreciate, I'm so honored of being here, of being part of CAAN's family. I'm the communications manager. My co-worker, Sugandhi, reminded me that I didn't introduce myself from the beginning. So it's when you get used to be like behind the scenes, that's what happens. So I'm Nuria, I'm the communication manager for CAAN. I'm so honored by being part of this family. And as I said, I'm gonna share this tiny conversation with Rita, who was really generous with me. She has been really generous with me, supporting me and starting this incredible journey. And well, yesterday we had like a final conversation, Rita and I, to say like, okay, what do we really want to communicate in this chat? And we came up with this final thought about that the most effective communication technique is about being human. And we have the source, we have the tools, right? We have internet, we have computers, we have social media, we have all of these incredible creations, I would say, that are tools, and that many of us have access to those. But we really want to acknowledge and privilege in our institutional communication the confidentiality of each community member, internally and externally. And that is the main principle in our communication plan, taking care of the integrity of our stakeholders, because that's what makes us really big as CAAN, right? And as we've heard, there are so many challenges that our audiences are dealing with, like labels, safe spaces to speak out, living remotely, access to technology, and so many intersectionalities that are issues that matter when communicate. And from CAAN's perspective, communicating effectively is possible by having these encounters to listen what our users need and facilitate those conversations to build and expand our capacities. And for instance, having this partnership with VIV and Impact, who are on board, is part of that expansion. It's part of us not only to expand, but also to look at those blind spots that we can have when we communicate, which is totally normal. It happens like as individuals and as part of a collective. So regardless if we are communicating online or offline, the real communication really happens when we encourage this going back to basics when communicating, because that's really human. And listening is the most effective channel to communicate. And so having said that, I really think this space would be great for you to tell us what is the most convenient channel for us to communicate and to share information with you. Rita, please jump on.
Just to build off of everything Nuria touched on, I've been working with, my team's been working with the CAAN teams the past few months to go over communication strategies, and, you know, acknowledging that with different groups and different stakeholders, you have to communicate through different tools, because, you know, although it's 2020 and many people are online, we know that many people aren't. If you live in a rural community or a rural area, a remote area, if you're part of an older demographic, or if you don't have access to technology, either due to technological barriers, affordability, geographic or demographic barriers, there's lots of people who aren't, you know, as active on the internet or social media or different platforms. And so we still need to rely on some of those traditional means for communicating with folks, such as, you know, face-to-face interactions, conversations with healthcare providers, having pamphlets or billboards or posters, or using traditional media like newspapers and magazines. And I think that's why CAAN also tries to communicate in as many different methods as it can, including online, but also through fireside chats like this. And we would have loved to have done this in person, really built that human-to-human connection. And just sort of hearing from everyone today, I think there's a lot of issues that still need to be addressed. And there's a lot of, someone had mentioned it in the chat earlier that, funding is being cut for organizations dealing with HIV issues and Indigenous issues, and that's a huge problem. And then someone had also shared that some of the healthcare providers don't necessarily understand the stigmas that people are facing. And we need to make sure that those conversations are had and those groups are communicated to. Oh, did someone have something to add? Nope, someone's mic was just on. That's okay. But yeah, and as Nuria said, we think that online or offline, it's important to go back to the basics and just make sure that people are feeling heard and people are part of the conversation instead of just being talked to. So for me, for example, it's really great to hear from someone like Marvelous who has lived experience and is open about sharing their stories instead of just saying, this is what you should want, this is what you should do. And so Nuria, if you don't mind, maybe I'll jump into a couple of the questions that we had for everyone. Great, because in the training sessions that we went through with CAAN, we went over all these methods and tools to talk to different stakeholders and share your tools. But we think that since we have you all here, it's important also if we could gather from you folks what works best for you for getting messaging and information. So just if anyone wants to share, are there any preferences for gathering information in relation to HIV knowledge and research? Is it through social media? Is it specific websites, Google searches, your doctor's office, traditional media, pamphlets, word of mouth? Where do you gather your information from, and what seems to resonate with you the most? Or even if any of the speakers have anything that they think works best for them? Maybe we'll share a couple of the questions, and then if anyone has any comments, they can put them in the chat. Because the other comment that we wanted to discuss and share also today is that do you think that there's information being shared that resonates with you? Do you think that the messaging is on point? Do you think that they're not addressing certain issues like stigma accurately? Or do you think that a lot of the messaging that you see out there is accurate and portrays the issues accurately? For example, Marvelous had mentioned in her presentation that I think it was 52% of women are the individuals with HIV, but they're only part of 19% of the research. That's an issue. That means that women with HIV aren't getting their stories out there as much and aren't being included in the research and the messaging that's out there.
Or also in the language, right? Like probably
right.
We think like okay, this is like the final journal. This is what we publish. This is like the information that we gather. But probably our main user is not understanding what we are trying to communicate, right? So like, do you need like a simple language, like a basic language, like what, or literally like, I rather to get a comic, like. I want to see a comic because that resonates with me, that feels like less pressure, or it's like, for me, it's like a storytelling, and I can share that comic with my family members or with my community members. So in which way do you need for us to present and deliver that information for you?
Marty just had a good point that she said to me. She said, maybe we should encourage folks, if you want to turn on your cameras, turn on your mics. I know we're entering into the sort of question and answer period. So if people feel comfortable doing that and can engage in more conversation that way, that'd be great.
And also, yes, someone.
Go ahead, Jen, sorry.
Rita, can you repeat your question? What did you ask?
Yeah, so really, when Nuri and I were hoping, just instead of telling folks, what communications techniques are best and work and what you should be doing, we wanted to just hear from folks what types of communications techniques and tools resonate with them the most. Where do they get their information from? And I know that we're all from different parts of Canada. We're different demographics. We have different personalities. So just wondering what works best for the other people here, and what could CAAN perhaps do to better communicate with women living with HIV. but that's fine. We can maybe, Marvelous, if you want to maybe get started on just the general question and answer, we can do that now.
So for me, maybe my question, while we are on communication, I just wanted to say, we don't know when COVID is stopping. We don't know when it's ending. And we still have to access our physicians. We still have to access blood work. And most of the physicians, I don't know in your areas where you are staying, is virtual. So when you are on virtual, sometimes I've seen that the physician wants to go. So I was thinking also in terms of communication, maybe one of the things that we might need to find out is to look at communication during this COVID period, because we don't know how long it's going to take. And then the information that we get will help us to be better prepared as agencies, but also it makes us better prepared also even us as VIV to see like what are the imaging issues. So it's not only in research, it's also, remember what we do in research informs the programs we develop, also informs the policies. So we have to think broader to like whatever we want the agencies to do for us, we need to share with them. Even the little that we think it doesn't matter, it matters. Because that informs how much funding we are going to get for services. It informs also, and research plays a big role, because by collecting that data that our members bring up, we can showcase that, out of the women that we serve as CAAN, so many of them are saying English is hard or whatever, my interaction with my physician is hard. That information will help CAAN also in their strategy and strengthening their way forward when it comes to communication, and also with policy. When they are working with the policy advisor, I think that also will help out. So no matter what little information you think might be little, it might not be little. It will have an impact.
That's absolutely right, Marvelous. And I think that's why CAAN over the next few months will be engaging in more conversations directly with stakeholders and decision makers, because if they need to know what the issues are, they need to hear it directly from the people on the front lines, quote unquote, and have recommendations for what they need to do better as well.
So do you think then, of course, we are hearing CAAN staff, we are hearing other stakeholders like VIV talking. Do you think on these platforms in future, we might need someone from the parliament? We might also want to hear their vision if they are able to. I'm glad that at VIV now, and most of you knew Matthew. Matthew left to go to another position, but I'm glad that Emily, who's with us also on the call here, and I've got Celine also from VIV on the call. But I think that should be also, because we always hear ourselves talking. What about the people from top? We also want to hear if they hear what we want. So maybe these platforms could be other ways of engaging with them. And I know their time is limited. I know they don't have, if it means it's their secretary, it's also okay. So we also want to hear the voice from top. I don't know, any thoughts about that?
Gilbert has put a comment in the chat here, maybe suggesting that maybe people feel like communications are never made to include them. And Gilbert, if you want to go run with it, go for it.
Yeah, well, I'm not a woman and I'm not Indigenous, so it's all by interpretation that I do that. But sorry, with encounter experience, I feel that the people that we talked to were feeling kind of stranger in their own land, on their own land. Mm-hmm. So they always felt a little kind of, is it my place to be inside or to be with with these people or in this waiting area and things like that. So the imposter, the kind of impersonation of a stranger is there in the feeling, and that makes also that many were fearing that their story would seem to be the kind of the anecdote of the week, or this special case of the week, because they had to repeat and repeat and repeat it again. So what we had as a feeling and it was half women and half men talking there in encounter is that they needed a place where they were not the stranger. They could be understood for what is their condition, what is their place, and to be respected in their dignity, in their in urban area, for example, many people that are on the street and indigenous, including Inuit, half of them being Inuit in Montreal, they were many had some comments that I heard on TV that they were better there on the street than they were with their community for many reasons. So if we look at them as an intervener, as poor people that are the last of the last, and that we judge them already by their position in the urban society, we don't recognize what the kind of keep by living on the streets and being there, which is, for example, to have access to the horizon, to have a landscape view that is over there. If you remember, the Inuit, they don't have walls, they don't have trees, they don't have a forest around them in their land. They have the sky and the all the distances are out there. And I heard from people intervening with them in Montreal that what they wanted to have when they were in the parks and things like that was the landscape open. So if we always feel that it's strange, it's difficult, it's special, well, they will react as say, I don't have a question for you, sorry.
Russ, thank you for that. I also see that Harvey wrote a comment that perhaps the factor is that HIV and HBC are seen as manageable diseases, so they aren't necessarily taken as seriously and listened, and they're not asked as much or listened to as much.
Yes, but you know, the people that were HIV positive in the little sample of people that we had were taking their pills. They would go to the doctor when they needed it. It doesn't mean it was a fun experience and they could share everything. They could ask a question about their own conditions or how they feel when they are maybe attracted to some person to sleep with. But they were not, the problem of access when they were HIV positive was not necessarily high. And we had we saw the same conditions in even in desertic places in Africa, where we thought that people would not take their pills because they did not have access to water and things like that. Well, even they had kilometers to walk to have their water for drinking and having it at the right time for their pills every day. They saw a lot of people being very disciplined and taking care to have enough water to drink, to take their pill every day. And that's the same that we have with Indigenous people when they are informed, when they are taken care of, when they have access to the pills. So it's the problem might not be on their side.
I love all the lessons that are coming from the encounter study. That's it's incredible, Jeanette. Thank you.
You will make me cry.
Wow, that's mutual, honestly.
I have a question. Maybe already you said something about it. So I just wanted to find out, so in the study that you did, how do you communicate back the findings to the people who participated?
Through people like you. So far,
Yes.
we did mostly communicate with the people that were in CAAN and other areas like that. The feedback to this community is to this sub-community is difficult, and we didn't have means to do it directly, I mean, and with the COVID, we cannot expend anything, but that would be through the Friendship Center that we could say something, but it's a need that is to be communicated. It's not solutions. And when you speak of 1,000 people in total in Montreal being in this condition, you don't speak of a lot of people. You cannot count on the kind of victims to be taking care of themselves and to be autonomous in getting out of it, or getting better conditions for where they are. It's we believe, I think, and that was part of our conversations, that the Indigenous and Inuit communities that are urbanized also have to be concerned with that and to do it. So we did some feedback on the Indigenous tables in Montreal. I spent last year communicating again and again to everyone, the nursing services, the Indigenous tables, the Indigenous people taking care of health, the anyone who was around. They heard, they listened. RV was a marvelous pilot into that, inviting me to speak everywhere and to be present as much as we can. But it's like the power position of these people is like if you count on a child to raise himself. He may have the will, but he may not have the means. So you need to be parent of these people with them, but at least we need an initiative and a support that is active from the Indigenous communities and the healthcare community to take care of that. I will not be the solution, and I'm just a messenger here. That's too small.
Well, I guess naturally we are landing in the last part of this Fireside series. So it's marvelous now. I'm gonna give you back the mic. So to finalize this section, and of course we are still open to listen all your insights about communication. I just dropped my email there in the chat. So we are, like, for us, this is a learning process, and we are learning from one another, and every insight that you have is gold for us. So please, whatever comment later on, it doesn't have to be today. Like the door is open, and that's what is CAAN. It's a house where everybody can live there. So please feel free to send me any kind of email about whatever. Also, we can have like a virtual coffee, and I'm really open to that. So thank you, Rita, for sharing this opportunity with me. And please, Marvelous, we go back to you to make the final part in the closing.
Oh, thank you so much. So far, I'm feeling energetic. I don't know about you, but just the conversations are keeping me wide awake. So already one of the other questions that I was going to ask is what needs to be shared more and promoted, but I think we already touched on some of those things. But I also saw from Harvey on the comments that the concept of U equals U needs to be promoted, both from HIV and HCV. And I think that's a great point, because people have got different interpretations of what that means. And I know that in some areas already there are ways of how people are doing that through media. And I also saw that at CAAN, you often speak of stories, languages, and culture, and also different as channels of communication. Because you might see U equals U and not even understand what that means if you see it there. But if you sit in a circle and share it, I think people get to understand and also to ask questions. Think about, is there anything else that you think as CAAN, even, I'm asking also CAAN staff, is there anything else through these conversations that you think when you were talking, something came up in your mind to say, oh, I think we should do this more, or we should promote this more?
I often Rolodex through a list of all kinds of things we should do more. But I think, you know, there's like what's really helpful, and as we sit around the fire, I guess it's also a bit of a space to be honest, to say, you know, like this is a challenge for us, right? I mean, you know, I'm trying to learn Instagram, but it's hard. Facebook is barely my speed, and Twitter is terrifying. So, but I do know, even just thinking about, you know, it's been quite interesting to me listening to news around COVID, right? And, you know, well, it's the young people who are driving COVID, or it's these people who are, and again, like, you know, there's lots of commentary. It feels a bit reassuring that clearly even people dedicated to really great communication who have way more resources are still struggling with how to package messaging well, right, in a way that is taken up, and you know, in the context of HIV, I think of our experiences around condom fatigue and safe sex fatigue, and, you know, the fatigue of the messaging, and one of my ongoing sitting around a fire, toasting my marshmallows and thinking about, you know, when we talk about stigma, I'm on a mission to try and find, you know, what is the, and this is part of CAAN's experience of the strengths-based. That moment when we kind of realized this terminology about strengths-based approaches, I feel it felt like particularly in that project about alcohol use, where we realized, and even more from that project, when I started doing presentations and I was standing at the front of the room saying, we really learned from our research that these things are effective, as opposed to standing at the front of the room and saying, don't do this and don't do this, and people, this is really, you know, very judgmental and you shouldn't do this. All of a sudden it was like, you know, these are the things you should do. These are the ways that we can make spaces more welcoming. I'm wondering what that language is for stigma, for the ways that we, instead of having anti-stigma campaigns, we want loving campaigns, or we want ways of, I'm looking for ways of kind of framing what is the positive other side of stigma, the yin and the yang of stigma, right? There's stigma and there's love is all I've come up with so far, and I think that's true, but I'm not sure how that carries out in messaging, or if that becomes too artsy or too flaky or too wishful thinking. But yeah, when we have, we all have limited attention spans. We're called into so many different ways of communicating now, and yet there's so many key messages and important parts of the things that we know will make our lives better and make the lives of the people we love better. So it's what keeps me excited and keeps me up at night. How can we do better? And yeah, and so I hope sitting around the fire is one way that we can do better. Although keep looking for more.
Thank you. Sarah, you want to say something?
Yeah, I just wanted to, I think a couple of things that came up for me in these conversations, and thanks for everyone who shared. It's been so lovely to sit around this fire with you all and listen. Yeah, a couple of things that resonated for me or that came up for me is that I think that like in terms of messaging or communication, I think that one big thing that I spent the last 12 years doing sexual health education and mental health and anti-oppression and decolonizing workshops in communities all over Manitoba. And one big thing was always that people want to see themselves represented in the communications. People want to see their who they are, what they look like, their culture, their communities represented in the in communications. I think that that's something that I have really been thinking about throughout this conversation and communication, and how can we do that? How can we do that effectively and better, especially as a national, Indigenous organization, and not wanting to pan-Indigenize communications as well. So these are just some things and some thoughts that came up for me, and also the use of I like Renee, that you said the anti-stigma campaigns. I think like focusing on what people say that they need and want in campaigns, I think is like a very strength-based way to get anti-stigma messages out there. And one teaching that I once received from Leslie Spillett and Tasha Spillett was, I think that sharing stats is not always decolonizing, right? The stats are connected to our relatives and the histories and the stories, and so if we're sharing stats in campaigns, that they always need to be connected to the history and the stories, and also to share like what is being done and what people want and what people need. So focusing on those messages of like, this is what needs to be happening and this is what we want to be seeing, right? And so I think that's another thought that came up for me. So anyways, thanks everybody.
Thank you so much. So as the fire is about to be to be cold soon, I think I have also another question in the comment or question on saying what are some ways that CAAN can communicate about policy to community, current policies, hot topics, upcoming opportunities to engage. We are currently updating our website, but are there other ways CAAN should think about communicating policy? So if you want to add some more on that, please feel free to ask on whether you want to tease out the question. Are there any other ways that CAAN can take into consideration when they want to communicate about policy to the community? Is there a right way to do it? Should it just sit on the CAAN website? Is there a way that you want to share it, maybe during the AGM, or how else do you want to share it? Maybe that's such other opportunities of giving advice on what we can do with policy and communicating it. Looks like you're tired.
Or maybe everything's just perfect, Marvelous, so CAAN doesn't need to communicate differently.
Well, sometimes if people are too warm on the fire, they tend to want to sleep or to just... But if you don't have any thoughts about it right now, but maybe the policy advisor can put the email in the chat so that if there are any thoughts, we can follow up even after the session and continue with the conversations. I think from my end, I'm done, and thank you so much for the opportunity of being open and sharing also the encounter study, and also hearing your thoughts and sharing your personal experiences. I can hand it over to Renee for last words. if you want to say something.
Oh, and I just actually private messaging Nuria. I wasn't sure if Karen, no. So well, then I will say thank you so much to all of you for joining us, and for staff and for community colleagues and staff across organizations and for all of the work that we're called in to do and the ways that we do the work, for sharing this time. I know that our friend Wanda often closes our meetings reminding us that that the sharing of time is one of our most precious gifts, and we can never get that back. And so taking the time out of your day to be here together and to help us to think, to share in this energy is a really precious gift that means a great deal. So this is
one more addition. Sorry, one more addition before you do the prayer. So previously I mentioned that we have Emily who joined us. So when it comes to communication, and also when it comes to, please I know she's not saying it herself, but be free also to knock on her door. She's a new pet you. Maybe if you just unmute and just say hi. We can't hear you.
Yeah, you're unmuted. You've clicked the button, but somehow the audio on your mic maybe isn't picking up, Emily. Yes.
No, I just wanted to say thank you, Marvelous. And yes, my door and email and phone are always open. Maybe I'll just post my email address in the group chat here so that everyone can have it. But I just started with Vive on Monday, as Marvelous mentioned. So I'm really looking forward to hopefully meeting all of you one day in person, but working alongside you in the very near future. So I won't take any more time. Thank you.
That's wonderful.
Thank you.
Sorry, I got one thing. I'm getting used to my new computer here. I can't scroll up, so I can't see, and I left the room for a minute and I come back and something about Harvey said some committee. What was the committee pertaining to?
Harvey is suggesting that we should create a committee comprised of healthcare providers and consumers to provide advice on the direction of how CAAN could look going forward. And this, and also a clinical committee, which includes community health representatives, Indigenous nurses, and clinicians who have the credentials to provide constructive feedback. So I think he's calling us into a particular kind of structure that we could imagine. I mean, this outreach and effort, you know, CAAN has we have meetings to plan meetings and committees to make committees. So that's definitely work that I think that we can really pay attention to. And of course, Harvey has been a very generous contributor to CAAN's work, as you have, right, over the years. So that's wonderful. And then really, I think, you know, the intention of sharing our email addresses, and CAAN's really working on our Facebook page. So like, keep letting us know how we can do better and how you want to be involved. And I promise that we're doing our very best to keep up with that and to take you up on that. And we don't mind being reminded kindly that there are opportunities that we might be called into. So this is part of a series. The Fireside Chats is a whole bunch of research projects that are looking at and engaging and responding to Indigenous women's needs and lives and realities. And so this is every month, there'll be a different project in the spotlight, all different strategies and ways of sharing and presenting. So we really look forward to continuing to share that and engage and meet together and circle around our fire until hopefully next summer, we're all able to be together in person in Saskatchewan to celebrate. And we'll have this whole context to build up and have a whole different conversation around the fire then.